Okay, thank you and good evening. Thanks everyone for joining. Welcome to the last session of the Taping and Movement series with Elastoplast Australia New Zealand. This is the last of an 8-week series that we've been putting on for you, and hopefully you've been enjoying all the fabulous presenters that have been giving you loads and loads of great information. So thank you again for joining tonight. Wherever you're from, in Melbourne at the moment, it is dark and it is very cold. We've had a freezing morning, and certainly winter has kicked in. Tonight we're going to be looking at the wrist, the hand. We're going to do a mixture of different taping sessions or taping techniques. Please, if you've got any questions at all, don't hesitate to send them through. Pop them through on the Zoom to one of the Elastoplast admin, and they will forward them to me, and I'll get through as many questions as I possibly can tonight. Of course, we can't always get through all of them, so I apologise in advance, but we will do our best to answer as many of your questions as we can. And these are a selection of taping techniques that I use commonly on wrists. We see a lot of injuries from people who are falling on outstretched hands. We see a lot of injuries on thumbs and fingers that get bent the wrong way, whether it be netball, football, martial arts, volleyball, etc., or just working around the house. So these are probably my most commonly used techniques. I think we've probably got 6, maybe 7 techniques to get through tonight, which will take us up for the full hour, no doubt, along with some questions. And we'll hopefully give you some valuable information that you can go away and practice with. Thanks again to Elastoplast for putting this series on, and especially for giving us all this fabulous product. We're going to be using a variety of tapes tonight. We're going to be using everything from a rigid strapping tape to underwrap or Elastorwrap Sport. We've got EAB tape, which is an elastic adhesive bandage tape, K-tape or kinesiology tape, and I've even brought along some Elastoplast spray plaster, which I'm going to demonstrate how and when I would utilise that product. So we might get started. Firstly, I'd like to welcome and thank you Matthew Abella. Matthew is a budding professional, on his way to being a professional beach volleyball player. Excuse us while we get set up here. And he's kindly offered to supply us with his forearm and wrist tonight. And I must say, it is possibly one of the more hairy forearm and wrists that I've taped in a long time. So I apologise in advance, Matt, that we're probably going to lose some of that hair. But this is where we're going. And we're going to use this spray plaster to help us out. So first technique we're going to do, we see a lot of injuries with just general compression of the wrist. So someone falls out, their wrist is extended, we get this force going up through the forearm. The carpal bones, which are the small bones of the wrist here, between our radius and ulna and the fingers, we have these 2 rows of carpal bones, and they get compressed, and they can get injured, they can get strained, the ligaments between them can get strained, they can get inflamed, etc. So quite often what we do is a very simple compression tape to put all of them, sort of give it a lot of support and compression to the area and help it feel a lot better, give it some support and help to try and reduce some of that inflammation. So we're going to demonstrate that one first off. Just going to ask Matty to sort of rest his wrist over the edge here. And we're going to ask him as if he's going to hold a large glass. I'll get you to just, pint of beer, something like that. Our first thing we're going to do is use an Elastorwrap Sport, which is an underwrap. This is to help protect the skin. It also helps our next layer or our rigid tape stick a little bit better to the underwrap here. So we measure him up. We're going to do, for Matty, we're going to do two kind of circles over his wrist there. And one of my favourite things in the world, I've got all the Elastoplast tape scissors. These are the best things ever when you're trying to cut tape. Now you'll see here on the Elastoplast underwrap, if you're not familiar with this, it has like a split down the middle. This is to make it easier to peel off. If you try and peel off half at a time, it can get quite tricky. I've noticed myself, if I grab both bits and peel it straight off, it tends to just hang really nicely. We then, again, ask him to hold that beer in hand. Pop this over the wrist, showing that. Wrapping around, and you'll notice as I'm doing this, I'm not applying any compression. So this is just laying this tape down. It's creating an undersurface. So I don't want to compress here. I'm not trying to use a clinical application here. You can see that's the kind of width we're getting. So we're probably a good 5 centimeters, 6 centimeters there. Then we follow that up with our 38 mil Elastoplast rigid sports tape. And this is where I might put a little bit of compression on. So making sure in this case that I'm taping over the underwrap, mainly to protect Matt's hairs as much as I possibly can. And you'll notice that I'm covering the tape as I go. I'll just get you to lift your elbow up, Matt. Just your elbow, sorry, Matt. There we go. Covering the tape a little bit as we go to spiral down towards the wrist. Okay, it doesn't matter if you spiral down or spiral away. And as I go, I'm not compressing too much. I'm just adding a small amount of compression to really give his wrist that support, make it feel much more comfortable post-injury. Okay, just getting to the edge of his hyperfix there. I tend to find also, just my own personal experience, that if I finish off on the back of the wrist, it's less likely to get caught on things. When we finish off on the front of the wrist, because we tend to rub it off things, the tape is more likely to get caught and roll up on itself. We then just add a little bit of compression. And as you can see there, very straightforward and simple compression of the radius and ulna and those carpal bones to add some support to the wrist. Now, if that injury was more on the radius or the ulnar side, so if it was more deviated to one way or the other, we can add some what are called stays in. So we can add some elements of tape to support that radial or ulnar side. How we do that, we'll take his hand into neutral. So let's say the injury was along this radius application, okay, this radius region. So if he'd injured himself and he'd deviated his wrist down, for example, and maybe he's injured the tissues through here, I would then ask the patient to just hold the wrist slightly up. Okay, so we're holding our wrist just slightly up to shorten that side, just a small amount. And then we take our rigid tape and we place that along that region. So I want you to drop your whole forearm down there. That's it. So we're going to go past the tape here and to his forearm. So this is providing a stay. You might have heard of these in braces. And we're doing this to kind of stop those tissues getting, or the wrist getting pulled back down. So again, we're in a slight deviation up. And you can see the first one there goes up towards the thumb, but doesn't pass the thumb joint. Okay, we want that to still move. And our second one covers that by about 50%. Okay. So now when Matt tries to deviate his wrist down, the tape kind of stops that movement. So it doesn't allow him to put a stretch through those already overstretched tissues. Now, if I wanted to do the same thing, we could do the same on the ulnar side. And we'd follow the same process and just ask Matt to deviate towards the ulnar side, shorten those tissues down to bunch them, and then tape there. You can add also an extra support here to hold it all in place with this fabulous stuff. Okay, this is a cohesive compressive bandage. You can also use an EAB. One of the reasons I love this tape is it's hand tearable, okay, and it sticks to itself. So you can wrap it up like this and it just holds everything in place beautifully. Look at that, looks gold too. Okay, give it a rip, compress it on, and that holds everything in place nicely. So we've got that compression over the wrist. We've added on a radial stay in this instance, and then we've wrapped it up with our EAB or this cohesive compressive tape. Just fantastic. Really, really cool tape. Okay, moving on from that one. So this is for our general compression of the wrist. Okay, we just did a general taping procedure to help support the wrist following a compression, and we've added on our stay. Our third one is a K-taping procedure. I wonder if we remove this tape from you or not. Now, look, we can go straight over the top of this. Normally we wouldn't, I must say. Normally don't tape over the top of tape, but for the sake of Maddie's hair, we might go straight over the top. So with the K-tape, so the K-tape is the Elastoplast kinesiology tape. Okay, this is our one-way stretch tape. I'm going to use a bright blue one tonight, just so you can easily see. And whenever we're using the K-tape, we always cut the corners off, eh? The K-tape stays on for up to, well, I leave it on for up to 5 days. It can get wet, you can shower with it on. Provided the patient doesn't get sweaty in the first 30 minutes, it has a really, really high adhesion rate. So it can stay on and be quite safe on the skin, as I say, for up to 5 days. It's a polyacrylic glue, so it tends to have a much lower reaction rate on skin as well, which is another reason why it can stay on for so long. As opposed to the zinc oxide glue that's in most normal tapes. So if someone's having an allergic reaction to any of the other tapes, then K-tape may be one to try. Of course, as always, if they get any skin reaction, take the tape off, wash the area, and maybe apply some ice if it's quite sensitive or painful. So with this K-tape, we're going to apply this over our thumb here. This is for an injury. When we get deviated down with our wrist, we can damage the tendons that run along here from our thumb to our forearm. So you can see on the forearm here, the tendons come along the thumb and they wrap up and over the forearm here. So imagining you've got a painful point right here and something's happened where you've damaged those tendons, this taping procedure can be quite useful for the pain that's experienced in that tendon there. So what we do, again, holding onto our big glass, we'll get you to stay in neutral there, Matty, perfect. And we're going to measure that tape from the thumb down to about the forearm there, just to, so the start of the forearm past the wrist. Again, we cut the corners off our tape. And in this instance, I'm going to tear the end off the tape. Sometimes we tear the middle, sometimes the end. And we'll demonstrate why. We don't like to touch the backing of the tape because the oil on your skin can affect the glue. So we lay that down nicely, get a good wrap on his thumb, fold the tape back and peel off the backing. Okay, now imagine we're going to hold that down in place there. So we'll just tilt you down a bit further again. I'm going to hold that in place. If I was to do a 100% stretch, that's quite aggressive. So I don't want to put 100%, but I do want to get a reasonable stretch. So I'm probably backing off to maybe a 60, 70% stretch on that tape. And we're going again from that thumb up, and you can see I'm deviating towards the back of the forearm. Okay, wrapping up through there with that stretch. That was our painful point. Okay, the last bit of the tape, no stretch at all. Okay, we never put stretch on the ends of the tape. We make sure that contour follows the skin nicely. Okay, then to support that, I'm going to use a black piece so that we can see the variation in colour here. We place a piece directly across. Elastoplast have actually brought out a while ago this kinesiology tape in the coolest red camo. I don't know if I do have one here. Check it out. Red camo kinesiology tape. All my athletes love it. Okay, in this instance, so we've got a small piece of kinesiology tape. I'm actually going to tear it down the center. This is because I want to put a compression over the center of the tape where that painful point was. So we're going to grab the two ends, fold them back, apply the stretch to the tape in the middle. Again, probably about 2/3 to 3/4. And we're going to place that over the painful tendon and then wrap down. And again, no stretch on the end pieces. So the two different stretch directions are both being applied right on that painful point. To show you there, I'll just bring that hand down. You can see that's wrapped up from the tendons of the thumb to the back of the forearm here. No stretch on the end point. Reasonable 2/3, 3/4 stretch over the damaged tendons. No stretch at the end point here. And then we've stretched through the middle to create a cross stretch here, again over that damaged tendon. You can then use your finger, or you can use the backing of the paper to warm that tape up. And of course, normally this would be applied directly to the skin, not applied over the top of 3 other layers of tape. So we're going to say sorry to Matt's wrist and forearm. And the hairs, oh, she's not going to even make a wince. Far too tough, this guy. This is how we breathe them here. So that we can do a few more taping procedures too. This is where it might hurt. Sorry in advance. Oh, yeah, this is the noise. It's the noise of when those hairs come off. I did, in my defense, ask Matt earlier today and say you may want to shave your forearm when you come or give it a clipper. But being the busy boy he is, no doubt at training, ran out of time. Yeah, ouch, ouch. All right, the other way we can do it without, only with those kind of special tape scissors would you ever do this. We can slide in underneath here and we can cut through our tape, which is really effective on the under-up tape. How are you coping there, Maddie? Mm-hmm. Oh, he's got some good hair stuck there. We might do a peel job for you just to save you the pain. It's only when it's the last piece of the under-up when the pain really comes on. I wish we had some background music or something we could put on for you. Oh. All right, what do you reckon? Do we give it a snip or do we go for the roll? He's not liking the snip. No, he was tough. So what we're going to do next is, we're going to do our thumb, EAB thumb taping procedure. This is a standard taping procedure for when you get a jarred thumb. Very, very common injury. And while I demonstrate, I might actually ask you to remove that slowly. So what we're going to tape is, you can see my quite arthritic thumb here, part of the role of being an osteopath, and part of the role of dislocating my thumbs too many times snowboarding. Very common injured site is this joint here in the thumb. So we're going to do an EAB, or an elastic adhesive bandage taping procedure to support this thumb. I should say at this point, the EAB is a fantastic stretch tape, and being a bandage type tape, it adds its own compression, so you don't have to put an enormous amount of stretch through it, but it's really effective. The smaller diameter, smaller width one, it's turning around the corners of the thumb. Very, very effective. When we are doing this, we'll get these out of the way. Again, ask the patient to hold on to, or to pretend to hold on to something large like a pint of beer or a jug or a large glass. So if I can get you to just rest over there. No, we haven't done too bad, not too many hairs off. See, back in Melbourne, the restrictions have eased and you can go and get a pedicure or a manicure, or just, you know, be a model in a taping series and have this hair of your forearm removed. So we're going to start on the back of the wrist here. And this is where I might utilize, sometimes if you've got a patient or an athlete who's a little bit hairy on an area, this spray can actually act as a little bit of a protection for the skin, and it does help the tape stick to it. It's a spray plaster, so it's designed to be used as a replacement for a wound care, but it actually works really well at providing just an extra layer of protection on the skin when we're trying to stick tape to slightly hairy areas. So again, this taping procedure is going to be to protect and to support that joint in the thumb. The other reason we get people to contract or to hold something is because then the muscles are on contraction, so the area we're taping is on its maximum diameter. If you tape any area or any joint, and the joint you're taping or the area you're taping isn't relaxed, it's on its minimum diameter. So then when the patient or the athlete goes and uses that limb or that area, and it may swell a little bit or it may expand with the contraction of muscles underneath and the expansion of the tendons, then they may get tape cuts, and the last thing you want. So always when you're taping, try and ask them to be active, holding that position, active in their muscles. So we're going to start here on the back of the wrist. We're going to wrap down towards our thumb. And again, this is not doing too bad, and that is good. When we wrap around the thumb, we create this very pretty, well, I think it's pretty, but I think all taping techniques are quite pretty, ribbon appearance. So if I drop Matt's wrist down, we can see how we get this nice cross ribbon appearance here. So we wrap up and over to the palm aspect of the thumb, around that joint, supporting the collateral ligaments of the joint, over the back and to the same position. And you'll see as I go along, I kind of change the angle just slightly. So I've started quite high up and taken an angle this way. The second time around, I've gone a little bit further down. And the third time around now, I'm getting closer to the wrist. Matt's still holding his large glass of imaginary beer there. And on this last one, it's quite a straightforward angle because we've got quite close to the wrist now. Now, if the patient has concurrent damage to the thumb that was occurred during, say, a wrist sprain as well, like that falling, something like that, you can additionally use the EAB here as we finish. I'll just get you to face that way, Maddie, to just continually wrap up and over the wrist. So we can see how with the thumb tape, we can additionally get a wrist compression. So we've got this nice ribbon thumb tape procedure here, supporting that joint and those collateral ligaments of the thumb, then coming back and adding a compression over that wrist there. To finish with the EAB, scissors to cut. And this is just a tip of mine from my experience, a tiny bit of rigid 38 mil, about yay amount to hold that in place. Okay, the EAB is a little bit thicker than a rigid, so it's more likely to get caught on the edge of things as we're moving about throughout the day. So holding our anchor down here with a small amount of rigid 38 mil, which is a thinner tape, is less likely to get caught. So when we're at the office, etc., whatever you may be doing in your everyday activities, just less likely that that edge of the tape is going to get caught. So it's more easy for the patient to keep that in place for the ideal time frame, usually 48 to 72 hours for this type of taping procedure. The K-tape, as I mentioned before, can be on for up to 5 days. But with our rigid tapes, we tend to leave them on for 48, 72 hours maximum. Same rule applies if the patient's suffering any burning, itchiness, redness, or soreness, then I take the tape off, of course. All right, do we need to? Oh, yeah, we probably do. Sorry, mate. So again, while I'm taping this off, I'll just remind you, if you've got any questions, shoot them through to the admin at Elastoplast. If you're doing any social media and you're looking to, yes please, thank you, and you're looking to tag us tonight, Elastoplast ANZ on Instagram, or paul.osteo.stay tuned. If you're looking at me, tag us and we can know you're there, which is always nice. So do direct any questions through to admin. Okay, the next one we're going to do is another K-tape procedure, which is an extension-based injury. So we're going to K-tape over the extensor aspect of the wrist. It's quite a simple procedure. Again, it helps support the tendons in the back of the wrist. You can do the same process on the front of the wrist or on the palmar aspect of the wrist, the forearm flexors. But in this instance, I'm going to demonstrate going through the extensors here. So we'll go back to our blue kinesiology tape. And with this one, I'm going to allow Matt to really rest his wrist down. And this is an instance where I will not get a contraction because we're not going over the diameter, circumference of the muscles. We're going along them. So the reason I want him to relax his wrist down is we're going to add a small amount of stretch just by having the wrist inflection. So our first bit of tape is going to go from here, before our knuckles, just past the wrist, and to about 1/3 of the way up the forearm. That's our measure point. You'll notice here another little trick I do with K-tape, as I'm cutting the edges off, I fold it so that when I cut the corners, that piece is ready, but also the next piece is ready too. Just a time saver if you're having to tape at events, sporting groups, and you're time poor, it can save a little bit of extra time for you. So again, we've torn the edge of the tape off, haven't touched it, and we've stuck that down with no stretch. We then fold back the tape to be able to remove our paper backing. Again, trying not to touch the back of the tape. I'm going to hold that anchor down, stretch up over the extensors. Now again, that's 100% stretch. I'm coming back to about half. Okay, laying that down as I go, getting towards, again, about halfway up the forearm, the end of the tape here, no stretch whatsoever. I then use the tape or your hand to warm that up a little bit. With K-tape, it's important that the glue gets warmed up a bit. You can do this before the application, or you can do it after the application. Someone should explain it to the patient, otherwise they might think it's a bit odd that you're sitting here rubbing their forearm or their wrist for a little while. And then we take our second piece and we're going to wrap that across without going the full circumference. Now, this can be take a bit of experience and a bit of practice knowing how far to stretch the tape and how long to cut it. I generally go with the fact that I'm going to put about a third to half stretch through it. So I measure just past half of the diameter. So in this instance, I've measured this without any stretch to be able to wrap around there. And by the time I put stretch on, I want it to finish up with a little bit of a gap here. This is so I'm not completely covering the circumference of the wrist and the forearm, mainly for circulatory reasons. So again, we're going to tear this through the middle, fold those backing papers back so we can hold on to them. And I'm putting the stretch through the back of the forearm here, the extensor tendons, where our pain point or our damage point is. And then we're stretching through, but again, not stretching the ends. And if I've done it correctly, oh, look at that. We've got a nice gap there. So again, not the full circumference. Okay, so we've got no stretch application at the end. Stretch through, again, half to 3/4 through our extensor aspect of the forearm where our painful tendons are. No stretch up to finish the application here. So our two anchors have no stretch on them. Then we've torn through the middle to place stretch over those painful tendons. Wrap around with, again, no stretch at our endpoints here. Okay, and that's going to give us some really nice support over those painful tendons. And because of the wrist was already in flexion, when he goes to neutral, it's going to have a little bit of extra stretch there anyway. Okay, because we taped the position in a flexed wrist. Okay, or you can actually leave that one on. We don't have to rip all your hairs off tonight. Okay, I'm just going to check, make sure there's no questions so far. No, we are good so far. Great. Okay, moving on to our next two taping techniques. Now, these are for the commonly damaged fingers. The most common damage we get to the fingers is we either hyperextend the finger, so we overextend it this way, or we get an excess amount of lateral or sideways motion of the finger. And the joint we tend to damage the most is this joint here, okay, right in the middle. We tend to damage the collateral or lateral ligaments of the finger. Okay, so we excessively bend it one way or another, and you can see those ligaments, when they work properly, they don't allow the finger to move that way. But it's quite often when we get a jarring motion, the finger will get, again, bent too far back or bent to the side. If you've ever damaged these ligaments in your finger, you'll be able to sympathize. But when they do get damaged, for whatever reason, you tend to catch that finger on everything in your life. You'll catch that finger and you'll re-damage and re-damage and re-damage. This is what patients tell me, and from personal experience myself, the same. It's like you would never have caught that finger before, but because you somehow know that it's damaged, you catch it on something and constantly keep re-irritating. And because these ligaments are quite small, they do take a while to heal, and they're quite challenging to heal. So we definitely want to support them as best as we can. We can do this in a solo taping procedure, which is an X cover procedure. It's a tricky one. Or we can do a simpler taping procedure called a buddy tape. So for example, let's say I damaged my first finger here, and I damaged it on the inside. So I want to avoid that finger going this way, going towards my thumb. Okay, I want to keep it from moving in that direction. Even if you did damage this side and you want to avoid it going that way, the simplest one when you damage the first finger is to tape it to the second. You can still use it in opposition. Okay, you'll still be able to bend this knuckle here, and you'll still be able to bend at the end knuckle, but we're going to avoid this motion, and we're going to avoid it bending sideways. Okay, so let's say that that's our buddy there. I'm just going to grab our rigid. So this is where we bring in our 12.5 rigid strapping tape. Okay, looks like this, otherwise commonly known as nail tape or finger tape. If you're working with any netball clubs, you'll be very familiar with this one, and the same version in a 25 mil. We go through a lot of these at netball. They tend to get a lot of jarred fingers. So what I'm going to ask you to do, Matt, is to simply take your two fingers out of the way here, as if you're making a gun. Yep, that's it. And the way we'll tape it up is below that joint. So we're going to tape this guy together. So we're below, if I turn you sideways to show, we're below this knuckle here. Okay, usually I do about 3 to 4 rounds, and I'm not adding on any compression here. This is the most common mistake made when taping fingers, is that we get too much compression and we upset the circulation. Okay, and then the second taping is going to be just past that knuckle. Okay, so we're in between the two knuckles. Again, gently wrapping it around 2 or 3, even up to 4 times, but not compressing. So you can see that's our end result, that we've allowed this knuckle here. So we want to get some good blood flow going down there, support those ligaments. That way we can bend, but we can't get any deviation between the fingers. It's not going to go in either direction. Okay, so it really supports it with its buddy. The other way to do this, we'll cover. This is where you hope you don't cut the skin of your model on live Zooms. Hey? That would be horrific. And again, never do this with normal scissors, only these very fancy tape scissors. Fantastic stuff. Okay, so a slightly more complex procedure is one where we do a single finger taping. So we might use your index finger here, Matt. And this is where we do a cross procedure. So we again take our same 12.5 mil rigid. And what we're going to do is we're basically looking to relay the collateral ligaments, so the ligaments on the inside and outside of this joint here. They're the most commonly damaged ones. So we start with our tape going across. I get you to turn your hand up. That's it. Across that ligament. It's about a 45-degree direction. This then wraps up. We go straight across, back down to create this cross. We wrap around, come up, again, 45 degrees up. around, across. So you end up with this almost like a figure 8 motion. Okay, wrapping around, across, and supporting that inside and outside ligament. So as we demonstrate here, there's a cross motion there. So we're going around, and coming across, down, around again, and then across this way. So you end up creating this nice cross across the finger. And what that does, once you've done a few rotations, is it essentially will stop that finger from moving too much. Quite difficult to move, still able to move at the end point, but not too much at the knuckle, a small amount so it can still function, but it really stops these lateral motions, so it supports those collateral ligaments. Okay, so that's our solo finger taping procedure and the buddy finger taping procedure. So again, to reiterate tonight, what we've gone through is we've done the full normal compression over the wrist with our under wrap, our Elastoplast Sport under wrap tape. Then we've gone over that with a rigid taping procedure, straight over the top. We've added in this case, we added in a radial stay with the rigid going over there, and we compressed all of that, or supported all of that, with our cohesive compression tape, or what you can use as an EAB. And you could do the same thing on the ulnar aspect. We then did a K-tape procedure for our thumb tendons, the extensor tendons of the thumb here, and supporting that radial aspect. When we also did a K-taping procedure for the full extensor of the wrist, which again can be the same on the flexor aspect of the wrist if you happen to have a hyperextension injury where you damage the flexor tendons of the wrist. This was for the extensor, so our hyperflexion or overflexion injury, and we've damaged those those extensor tendons. So that was our K-taping procedure for the extension aspect of the wrist. We did our traditional ribbon or EAB tape for the thumb there, wrapping that round and supporting those ligaments either side of the thumb that commonly gets jarred. And then we've done our 2 finger tapes, our buddy tape and our solo tape. So we've got a bit of time left to answer some questions. Why would you use an EAB instead of an RST? I'm assuming an RST means a rigid strapping or rigid sports tape. So EAB is an elastic adhesive bandage. When we use an EAB, we're trying to add a little bit more compression, but it does allow motion. Okay, so I use an EAB in a similar circumstance, sometimes with a K-tape even, or sometimes with a, like I said, Leucolite, a compression type stretch tape when I want to compress the area, but I still want to allow some motion. When I use a rigid tape, I'm generally trying to restrict motion. I'm using it to stop those collateral ligaments from moving. I'm using it to completely lock out a joint. Or if I wanted to, let's say I put a radial and an ulnar stay and rigid all the way around, then that wrist essentially is not moving. If I did the same thing with an EAB, it'll add compression, but it'll still be able to get some motion. So that's my decision-making process in terms of being a practitioner. I should have said at the start of this, for those who don't know me, I'm Paul Hermann. I'm an osteopath. I'm a sports scientist, exercise scientist. So I practice these techniques on a very, very daily basis with a lot of my athletes. And that's my decision process when I'm applying these to my athletes is, am I trying to restrict motion or am I trying to support and compress whilst allowing or facilitating some motion? Great question. What are some good exercises for the wrist and fingers after common injuries? All right, well, not being a specialist hand therapist, this is what I use. These guys have all sorts of cool putties and they have all sorts of cool toys that they can use. But without any of those cool toys, there are still a variety of exercises we can do. To get the fingers, post-injury, we want to try and get some strength into the individualization of these fingers, and particularly the extensors of them. So one of the common exercises to do is to put your hand flat on the table here, and try and practice lifting one finger at a time, including the thumb, without any of the other fingers lifting and without doming the palm. So you keep it as flat as you can and you lift one finger at a time. And you'll think, oh, this is easy. Wait till you've done about 10 reps on each finger. And then you'll be like, I really hate that guy, Paul. This exercise sucks. Only because it works so well. It really does help strengthen up a lot of the extensors through the back of the forearm. In terms of strengthening or re-strengthening the flexors of the hand and the forearm, the good old tennis ball, crushing it in your hand and just practicing, or the stress ball or magic putty, Play-Doh, anything like that, where you're basically crushing it into your hand and practicing that flexion is a fantastic way. And then doing the same thing, but doing it with each finger. So slowly working through that putty, going one finger at a time, trying to work that. And that works all of those flexors. So again, extension exercise for the extensor muscles and flexion putty or isolated flexion one finger at a time for the flexors, sorry. How long would you recommend taping your finger or thumb for sports after a break, dislocation, or severe jar? Wow, that's a complex question. It would completely depend, and I know people hate getting these type of answers, but it is a tricky one because it would depend a lot on the fracture, whether it was a simple fracture, whether it was a fracture with dislocation, where the fracture was. Some of the larger bones heal up quite quick, and others, like some of the small carpal bones, take a long time to heal because they have a smaller blood supply. We have to be careful around the wrist. So for example, if you break your scaphoid, it's very important to get that scanned and properly seen to by a specialist because it has an artery that only goes in a one way. So if you break it through the middle, sometimes the end can become necrotic or die, and it can get all sorts of complications. So depending on where we do get our injury in the wrist, it does change the tissue healing time and therefore the length of time that I would add a support in afterwards. Generally speaking, in very, very, very general terms, we always say that once you've gone back to your sport, whatever the injury, you're still in rehab for a whole season. Okay, so you're still trying to work on rebuilding strengths and improving imbalances or restoring balance to your body for an entire season. That doesn't mean I would necessarily be continuing to tape the same way for the whole season. I would ease off. So I might start, for example, with an aggressive rigid to restrict motion, and then I might go to a strong EAB, and I might go to a K-tape and kind of ease back on the support as the tissues heal and get stronger and stronger. So we'll go with one more question and then we'll wrap it up so you guys can enjoy the rest of your evening. Would I ever use a K-tape and a rigid sports tape or EAB together when treating these sorts of injuries? Or should they be always used separately? This is actually a really, really common question. I've presented taping workshops all around Australia for Elastoplast. I'm their national presenter, and I've done it all around the world too. And honestly, this is probably one of the most common questions. And my answer is, taping is like an art form. You learn the basics, you learn your anatomy, and then you apply them based on the circumstances you're in. And there are numerous circumstances where I have used a K-tape with a rigid tape. Earlier in this series, we talked about upper backs and taping across for posture. And that is a common one that I will use a rigid technique with a K-tape technique. I might use the rigid tape to, for example, I'll use a knee as an example. I might use it to support the MCL, but then I might use the K-tape to support the groin tissue. I might use it in the wrist, for example, that I'll put rigid tape through here to really restrict the ability of ulnar deviation, but then I might use K-tape or EAB to just add some compression around the wrist. So for me, it is really common that I actually use both types of tape. They're not mutually exclusive. They have different applications for different tissues, and injuries are often complex and affecting different tissues. So we may use that procedure for some tissues, and in the same injury, another technique using a different tape for different tissues. So yes, the answer is commonly both. Again, I want to thank everyone for joining us tonight. I want to thank Matt for joining us. Thank you all for this entire series and for joining us over the 8 weeks. Firstly, on behalf of Elastoplast Australia, thank you very much to everybody for joining us for the 8 weeks. Thank you very, very much to the presenters who have given up their time and donated their time. Without them, it would be absolutely impossible to put something like this on. And this was put on by Elastoplast very quickly when COVID hit us. So I want to say, both on behalf of all of you and behalf of myself, thank you very, very much to Lockie and the team at Elastoplast for putting this fantastic series on. I really, really hope you guys have got lots out of it and enjoyed the presentations. I know the presenters, being one of them, we've really enjoyed presenting for you, and we hope that the information helps you to help others maximize their function and to be able to do the things they love as much as they possibly can. Stay tuned for a lot more information coming from Elastoplast, and there's some exciting things happening. So the easiest way to keep on top of that is to follow Elastoplast on LinkedIn or on the socials, Elastoplast ANZ or Elastoplast Australia and New Zealand. You can find them on LinkedIn, find them on Instagram, and fantastic results, hopefully, fantastic things are coming from them, and that'll help you guys maximize all your results going forward. All right, thanks again, and everyone have a great night. See you.